and a wide variety of
Just a few moments left in this event. We'll leave it at this point to hear from Rhode Island Congressman Patrick Kennedy as he's marking April 20th, a holiday in cannabis culture, commonly referred to as 420, by joining public health officials and others to talk about federal marijuana policy.
Crowd around so we can get in more. Yeah, feel free to come on over. Yeah, let's crowd around.
Let me say, all right, why don't you
Get on by the flag. Well, good afternoon, everybody. My name is Kevin Sabet. I'm the president and CEO of SAM, Smart Approaches to Marijuana. We are very happy to be joined by multiple individuals representing organizations across public health and public safety. Just a little bit of background on SAM, and then we're going to turn it over to the other speakers. SAM was started in 2013 really as a response to the growing legalization of marijuana. And our message today is very simple on the unofficial marijuana holiday, and that message is we need to slow this train down. We need to put people before profit, and we need to get the science out about the true harms of marijuana, which every day are hurting more and more people as this country slides deeper and deeper into the legalization and really the commercialization of marijuana. We are also here to fight against this false dichotomy that you either have to lock people up in prison or legalize marijuana. In fact, we don't want to lock people up in prison for using marijuana, nor do we want people criminalized for marijuana use. But to be against criminalization is not to be for legalization, and certainly not really what we've seen, which is the commercialization of marijuana. Marijuana these days is much more Wall Street than Woodstock. Today's THC products are between 5 and 30 times stronger than they used to be. In fact, I don't think anybody over 30 would recognize the THC products that are being sold in our communities today. We're very happy at SAM to be part of really a growing public health and public safety consensus that we should have science, not deep-pocketed investors guiding marijuana policy. And so we're honored to be joined by one of our co-founders and honorary board chair, the Honorable Patrick Kennedy, who spent his congressional career and really his life fighting for mental health parity and this overall issue of mental health. We're also very happy to be joined by a number of distinguished speakers today, including this nation's first African-American magistrate judge, Judge Arthur Burnett Sr., Honorable Arthur Burnett Sr., Mr. Jake Nelson of AAA, the Director of Traffic Safety Advocacy and Research, Dr. Ronald Lev, medical doctor, Chief of Scripps Mercy Hospital in San Diego, Dr. Susan Weiss, the Director of Division of Extramural Research at the National Institute on Drug Abuse, which is an arm of the National Institutes of Health, the Honorable Senator Ron Rice, a senator from New Jersey and leader of the New Jersey Legislative Black Caucus, Bishop Jethro James Jr., the senior pastor of Paradise Baptist Church, and a senior advisor to New Jersey Responsible Approaches to Marijuana Policy, NJ RAMP. Doug Tiemann, the president and CEO of Caron Treatment Centers. We are also joined by a recovering addict, Alexa, who will share her story about marijuana addiction, because one of the big myths out there is that marijuana is not addictive. Dr. Christine Miller, a neuroscientist and advisory board member of Smart Approaches to Marijuana. You know, we are very concerned about the edibles, and we are concerned about products that are out there marketed to really our vulnerable populations. But we are also very heartened by the fact that even in the states like California and Massachusetts that have voted to legalize marijuana, the majority of localities are actually voting to not have legal commercial marijuana where they live. So it signals a divide, really, between people that want to decriminalize or remove criminal penalties and actually go towards full-blown legalization. One bit of news I also want to share, a recent string of polls by Emerson College independent polls, not funded by SAM, for example, Fairleigh Dickinson University, others like Mason-Dixon, which was funded by SAM, have found that when people are actually asked about multiple choices with regards to marijuana, their first choice is not marijuana legalization. And so a majority of Americans do not prefer legalization when given options like decriminalization and other policy choices. So we're really here to say that we're also putting the marijuana industry really accountable. We want to hold them accountable. Just like the tobacco industry, it took us, unfortunately, a century to hold them accountable, and we're still paying for those costs. We're very concerned that we notice that the tobacco industry in the U.S. in many ways is merging with some sectors of the marijuana industry. They are cross-hiring. They are investing in the marijuana business. This is not a surprise, but we know how the story ends. We also know how the story ends with our opioid crisis, driven by a legal drug and special interests that relied on addiction for profit. That's why at SAM we do not take any money from the pharmaceutical companies, from big pharma, opioid manufacturers, alcohol, or cigarettes, and we are funded by individuals who have had really suffered heartache from addiction. So I want to turn it over here. We have a very, very prestigious group of folks here, and I'm going to first turn it over to Jake Nelson, the Director of Traffic Safety and Advocacy Research at AAA, to really talk about this issue of impaired driving, because on this unofficial marijuana holiday, we have a warning for those on the roads given this issue of impaired driving. Jake?
I knew that was going to happen. As soon as we crowded. Good afternoon, everyone. In 2016, 10,497 people died in crashes due to drunk drivers. That's at a period of time when the rates of drunk driving have dropped over 30% in the last decade. Now, the same period of time, the rates of marijuana use among drivers has increased almost 50%. This is a drug that we know, without hesitation, at least doubles crash risk. It does it by impairing driver attention, coordination, and reaction time, among other skills that are very important for safe driving. Now, mixing alcohol with marijuana produces impairing effects that are greater than the combined effects of each drug used independently. And in fact, this is the most common way that people who use marijuana and get behind the wheel of a car use it, is they mix it with alcohol almost 2/3 of the time. Now, data suggests that legalizing marijuana for fun or recreational purposes has some pretty staggering impacts on traffic safety. A few years ago, we did a study at AAA that looked at Washington State, one of the first 2 states to legalize the drug for recreational purposes. And what we found was that the proportion of drivers involved in fatal crashes who had recently used marijuana more than doubled from 8 to 16%, or 17% rather, in that year following their change in law. And this is an eye-opening case study for other states who are contemplating the same decision. Now, also, this is a topic, the use of marijuana in driving, that a lot of people like to compare to alcohol in driving. The challenge is that law enforcement officers and the courts don't have the same tools available to them to manage this highway safety issue the way that we do for alcohol. There's no roadside test like a breathalyzer to detect the use of marijuana or recent use of marijuana at the roadside. And even if we did have a device that was reliable a majority of the time, the relationship between how much marijuana is in somebody's body and the odds that they will cause a traffic crash is not established in the research. And that's what gives breathalyzers for alcohol their power. That's how come when we know 0.08, we know what the odds of causing a traffic crash is at that BAC level. We don't have that understanding for marijuana. So this is a really unique problem. Impaired driving kills people well more than 10,497 in 2016, that's for sure. But the data that we have aren't very good when it comes to the drugs, especially marijuana. This is just the tip of the spear when we talk about this issue, and it's one of the many reasons why AAA is urging policymakers across the country to put public safety in front of drug recreational use. Thank you very much.
Good morning. I'm Judge Arthur Burnett, but in addition to serving 15 years in the federal court as a magistrate judge on intake of everyone arrested for federal crimes here in D.C., I served 17 years on the Superior Court of D.C., which is both federal and state jurisdiction. So that there I had both federal and state jurisdiction. So I have a total of 31 years of experience in dealing with people who are involved with drugs. Drugs from the point of view of neglected abuse and foster care. Sentencing thousands of defendants who, in their pre-sentence reports, told me how they got started with the problem of drugs. Homicide cases where people involved with drugs were aiders and abettors in drive-by shootings. I recall the case of a young guy who witnessed a drive-by shooting and fled to Mexico to keep from being killed. And when the marshals found him and brought him back to testify in the murder case I was residing in, he said that he was an A student at 4th and 5th grade level. But the drug gang beat him up and so forth, got him bloody nose, took his shoes, jacket, and they said, if you want protection, you got to be one of us. And one day they took him to a basement apartment to talk with the lieutenant. And the lieutenant handed him a marijuana cigarette. This marijuana cigarette, the guy said, I don't want that stuff because I want to be an outstanding athlete. He said, you ain't going to be nothing if you don't smoke it. By the way, it's laced with PCP. And he said in order to keep him being shot that day. See, what a lot of people in the media doesn't tell you, among some of our brightest young boys and young girls at the 4th and 5th grade with outstanding math skills, they are coerced into association with peer pressure from their school kids involved in drugs and so forth. And you say, well, you didn't get that high from marijuana. Let's lace it with a little PCP. Let's put a little LSD in it. And like I said, for 31 years, I sat on the bench and actually heard cases of this type. Probably I've heard over 5,000 to 10,000 cases. And what I fear in this, especially where people are unemployed, they're idle, they are subject to group activities. Some people say peer pressure. And it may not be that medically speaking, use of marijuana automatically leads to experimenting with heroin, experimenting with PCP, or some of the synthetic drugs. But the criminal problems I've seen in the nation's capital indicates that the problem of involvement in illegal drugs results from the opportunity, quality of education, dropping out of school, and then drug gangs who sometimes end up shooting across streets where they kill a 19-year-old girl headed off to college who was a straight A student in high school. And I've seen hundreds in the city of kids who were college admittees, innocent victims of homicides in drug warfare. So it's a lot more dangerous than even the traffic issues you've heard. And indeed, it is the beginning step to a life of crime.
Hi. I've been practicing emergency medicine in San Diego for 28 years, and they say the world is a stage and the people in the emergency department have the front seat. Working on the opioid epidemic for the past 7 years, I see a link to marijuana. I would like to share with you some of the stories I see and cases I see in the emergency department and what marijuana looks like at the morgue. Every day in California, we treat patients with marijuana poisoning. Every day. The number of emergency department visits related to marijuana has gone up by 830% in the past years, from 2006 to 2014. That's over 1,000 people to 10,300 people a year in San Diego alone. Picture a 25-year-old girl with loud, audible retching who's writhing in abdominal pain. We can hear her agony agony from across the emergency department. We term the condition scromiting. Scromiting is screaming and vomiting, and the hallmark of cannabis hyperemesis syndrome. She's been to numerous emergency departments and is receiving Dilaudid, a strong opioid, each time for her pain. She's been exposed to multiple CT scans and radiation, and yet she cannot understand what's wrong with her. Her cure would be simple: stop smoking weed. And the problem is that her marijuana addiction is becoming an opioid addiction. Every day, we treat cases of scromiting. My next patient is spitting and thrashing about. He's sweating, his blood pressure, heart rate is up. It takes 6 strong men to hold him down until the sedatives take effect. The diagnosis could be anything, but his drug tests come back with just marijuana. Just marijuana. And it was just marijuana who landed another patient on life support in the ICU, hanging between life and death as he was inhaling wax, 90 to 100% THC. And tourists, beware. Recently, I treated a man who was visiting our beautiful city for a convention. He came to the emergency department with concern that he couldn't talk right and his arm wasn't working. I did all the evaluation to make sure he didn't have a stroke. And with everything came back normal, he showed me a small package of gummy bears that was labeled hangover remedy. And he received a very expensive diagnosis of marijuana poisoning. And it was heartbreaking for me to treat an elderly man who traveled to our Scripps Institute for a second opinion for his cancer diagnosis. His son saw a prominent advertisement and was hoping the marijuana brownie would help with his nausea caused by chemotherapy. His nausea was not better, and I admitted him to the hospital with chest pain and palpitations from a pot brownie. A 3-car collision closed our freeways for a few hours as a driver admitted to be high on marijuana, and he will not enter the statistics because no one died. And what about the medical examiner? What does our medical examiner see? Deaths from all drugs in the past 10 years went up 56%. And at the same time, deaths from marijuana went up 64%. And there's a direct correlation with increased drug deaths and marijuana deaths. And we can no longer turn a blind eye between marijuana and other drugs. Who dies of marijuana? The San Diego Marijuana Death Diaries counted 462 people who died with THC in their system in 2016. A 1-year-old baby, a 15-year-old, a 19-year-old driver, along with 31 other drivers, a 55-year-old motorcyclist, along with 9 other motorcyclists, a 21-year-old who jumped off the bridge, along with 76 other suicides, a 55-year-old with hypertension, along with 63 cardiac deaths. And do you know that marijuana is associated with a 3-fold increase of death from hypertension? If you have high blood pressure, you should not be smoking weed. THC was involved with 29% of all homicides, 30% of all illicit drug use, 30% of prescription drug deaths, 30% of alcohol deaths. If THC was really a medication, the FDA would have a big black box warning. Marijuana legalization in California has unleashed a public health disaster.
Hi, I'm Susan Weiss, and I'm from the National Institute on Drug Abuse, and I don't have any of these stories that will really tug at your heartstrings to tell you I'm here as a scientist. And I will tell you that we support a lot of research on cannabis to look at the adverse health effects, to understand how it works in the brain and in the body, and even to look at the potential for therapeutic uses of some of the cannabinoid compounds. But what I want to talk to you today about, which is what most concerns us, has to do with the effects on the developing brain. And one of the things that we understand about how cannabis works is that there is a system, a signaling system called the endocannabinoid system. And it's a very important system in many physiological functions, including brain development. And I say this because one of the things that we're seeing is increases in use by pregnant women who are being given advice through the internet that this is a safe and natural and harmless plant to use to help with morning sickness. I would say that we do not have any indication that that is the case, and instead what we know is that this system is very important for how the nervous system develops, and it comes on board as early as 16 to 22 days of gestation. Among among the population overall of pregnant women, about approximately 4% report using marijuana. If you look at 18 to 25-year-olds, it goes up to 7%. And if you look at the youngest people who are pregnant, 12 to 17-year-olds, it's about 14%. And most use it in the first trimester, which is probably the most dangerous time. The other group that I want to mention where we have put a lot of, where we have more evidence has to do with adolescence. We know that the brain continues to develop into early adulthood, and the period of adolescence is a time of of quite active brain development. And so we have many concerns about exposure to the brain. We have a number of different studies that are all coming together to tell us that those who start young in their teens and who use frequently are more likely to see a variety of adverse outcomes. And this is on brain development, on brain function, as well as on academic achievement, employment, possibly their mental health, including an increased risk of earlier onset of psychosis among people who are vulnerable, as well as the increased risk for both addiction to cannabis and to other substances and cognitive impairment. So there are a number of these different outcomes that we're seeing, but one of the things that we are not, one of the things about these data is that they are not conclusive because there are always other factors that have to be considered. One of them is that many young people who use cannabis frequently are not using it alone. There are other drugs on board and they may also have effects. In addition, we don't know what these people look like before they started to use cannabis. There may have been risk factors that we are unaware of that lead them to these multiple outcomes. So one way in which NIDA and other NIH institutes are trying to address this problem is through a very large study that we're funding, which is called the Adolescent Brain Cognitive Development Study, or ABCD, which is a study of a cohort of about 10,000 kids beginning at age 9 or 10 before they've started to use substances to look at what the impact is on the development of the brain and on their growth trajectories in general. And we're looking at much more than just exposure to cannabis, although in fact the changing laws and the emergence of electronic cigarettes, all of those things were what prompted the study. But now that we have a much broader group of institutes that are interested, we're also looking at screen time and physical exercise and what are the resilience factors that could protect somebody. But we think this is obviously an extremely important issue for us to understand. And as I said, right now, what keeps us up at night is really the effects on brain development.
Doug?
Good afternoon. I'm Doug Tiemann. For the past 23 years, I've been the president and CEO of Caron Treatment Centers, and for the past 35 years, I've been in the substance use treatment field. And for those of us involved with providing treatment for those suffering from substance use, we provide the respite and resurrection for the casualties that you've heard the previous speakers talk about. But first, I want to say thanks to Kevin and Patrick for shining a light on this topic and for being out front and helping our country know the other side of the story. And what I want to talk about today is how did we get here? And one of the things that I have seen in 35 years is that when you put availability, accessibility, and affordability with any mood-altering substance, it leads to more addiction. And it's certainly been the case with marijuana. Last year, Caron commissioned a study with the Harris poll just to get some ideas about attitudes. And two that really struck out to me were 73% of all of those polled between the ages of 18 and 34 felt that marijuana was safer and far more okay to use than alcohol. 11% of the parents thought it was okay for their teenagers to smoke marijuana occasionally. And when we look at the correlation between marijuana and other substance use, Dr. Robert DuPont, former director of the National Institute on Drug Abuse, has extensive data. And some of the statistics that really jump out to me are even for the teenager who casually uses marijuana, they are 8 to 10 times more likely when compared to someone who doesn't use marijuana to smoke, drink, binge drink, and use other drugs. And if they use marijuana regularly, they're 15 to 30 times more likely to do those same activities. So what does that mean at Caron Treatment Centers? Because we see those casualties. A couple of statistics to think about. For our population over the age of 28, about a third of our patients will indicate that they use marijuana. About 15% will consider it their drug of choice. For our young adults, those between the ages of 20 and 28, about 60% use marijuana, 35% indicate it as their drug of choice. But for adolescents, 90% use marijuana, 70% have it as their primary drug of choice. That's the bad news, but there is hope. As I said, treatment centers provide respite and resurrection. Even though there's no medication-assisted treatment yet for marijuana, abstinence-based treatment does work. At Caron, we do extensive follow-up with the University of Pennsylvania to follow up on our patients. We use urine drug screens to corroborate whether someone is abstinent or not. And for our patients, almost 60% have been abstinent for the entire first year. Another 20%, while they may have used in the first year, are abstinent at the end of the year, so 80% alcohol and drug free. Another 10 to 15% that even though they haven't been able to remain abstinent, have reduced use, quality of life better, consequences down. So treatment does work. We deal with the casualties. I want to salute Patrick and Kevin for helping prevent those from coming to our front door. We can help those when they come, but in an ideal world, they'd never show up at our front door. Thank you.
Alexa.
Hi, I'm Alexa, and I am a recovering addict, and my drug of choice was marijuana. I started smoking when I was 15, and I started smoking recreationally at parties at 17, and by the time I was in college, I was using marijuana daily. I pretty much couldn't imagine my life without it. I literally couldn't do anything. I went to class high, I went to work high, I drove high. I used marijuana to feel normal, and that isn't normal, and I didn't realize that. I didn't even realize that I was addicted. It started as something fun, and it quickly became toxic. And I damaged my relationship with my family. I wasn't able to excel in school. I had brushes with the law, and it really took me down slowly. And I was at the point where I wanted to commit suicide. And I luckily checked into Caron treatment centers on December 28th, 2014. And that's really when my life changed, because Caron is the place that taught me what addiction and alcoholism looked like. And that helped me realize that that's exactly what I was struggling with. And because of that, I'm 3 years sober today. Thank you. And yeah, I mean, I'm really lucky to be standing here today, and I'm grateful for what Caron did for me and my family. It repaired my relationship with my family. I'm able to be a productive member of society. I'm able to be a daughter, a friend, a worker, and I'm incredibly grateful to be speaking here today, and I hope that we will continue to listen to the voices of those in recovery, because I think those are very important voices to hear. So thank you for letting me share.
I'm Bishop Jethro James from Newark, New Jersey. I'm also a chaplain with the New Jersey State Police. I'm also a retired corporate exec. Weird combination, clergy, cop, social worker. Weird combination. Helped orchestrate the campaign to bring Governor Murphy into the gubernatorial mansion. And yet and still, at my Martin Luther King Day, I stood up and said, we will not have legalized marijuana. Let me put on a couple of my hats. As law enforcement, we know what it does. Let's look at the statistics in the states that have already legalized marijuana, because it will devastate communities of color. In Colorado, for example, 55% increase of youth
caught in possession of marijuana in the African American community. You have to be 21 to have it. Well, we're finding out that our kids from 11 years old until 17 years old, until they're considered adults. So now you start off with a record. Let's talk about the Hispanic community. 38% increase in the Hispanic community of kids using marijuana. Let's talk about what it does to our babies. We're seeing from age 0 to 7 years old, a 70% increase in poisoning hotlines for pediatrics. Your baby, there is no EpiPen for your baby if he or she is allergic to marijuana, and their brain is going to be fried. Bishop, why would you take it on? Because being a social scientist, the last place that they're going to have marijuana is in the county where our governor lives. I've been to his home. There's already places in New Jersey that have already passed NIMBY, not in my backyard. You can't sell it here. Where's it going? It's going primarily to the urban areas. What's some of the problems in the urban areas? Well, first of all, unemployment. You will not retire from PSE&G or law enforcement or any major corporation if you test positive for marijuana. So therefore, the whole economic system will be brought down. Where will you place these shops? Let's take a look at Denver. Denver has more marijuana shops than it has McDonald's and Starbucks combined. They're all in urban neighborhoods. What will it do to the neighborhood? Well, let's talk about crime. You must pay for it with cash. You cannot pay for it with a card, can't write a check for it. So if I'm one of the local fellas that don't mind sticking up other drug dealers, your place becomes a prime place for my dealing and redealing. I talked with some of my friends in the DPA. We're finding out that marijuana, legal marijuana is being sold on the black market. Like anything else that there are plenty of it around if there's any commodity. Soybean, corn. You don't put it in a warehouse, you sell it to someone and that mixture. I happen to sit on the board of a hospital. I happen to know that just a week ago, we had 28 kids in 24 hours come in and they're out of their mind because of the combination. You need to understand that there is no standard for marijuana. I went to college in the 60s. The stuff I smoked was 4% THC. The stuff that's out there now is 38 to 98% THC. Every mother ought to worry about it. There was no opioid problem in this country when it was in places like Newark, places like Camden in New Jersey, places like Trenton or Patterson. These are the hoods, y'all. There was no opiate, but it got on the Parkway, and it went to places up county and places down county. And when the people that didn't look like me, their kids started dying, then we had an epidemic. I stopped by to tell you that you can't put this, and I say this to Governor Murphy, and I say this to anyone nationally. You want to know what it will do? Stick around and talk to me. The last thing I want to point out, Newark, Camden, Patterson, and Trenton in New Jersey, we have the birth rates of third world countries for our babies. I refuse to allow something else to bring down African American and Hispanic children, that our children may have a chance in life, a chance for employment, and a chance to live the American dream. Let me quote scripture as I go to my seat. The scripture says, "What profit a man to gain the whole world and lose his soul? And what will a man give for his soul?" And then there was another question asked and needs to be answered by those that made a promise. For our governor made a promise that he was going to let everybody out of jail that went. And so this is not social justice. This is social injustice, because he just zero-based last week. He zero-based all the reentry dollars. So he has no intention of letting anyone out of prison. Don't be bought by the hype. Don't believe the promises that are made. They want to have marijuana sold, S-O-L-D, but they're giving up your children, S-O-U-L. God bless you.
Good afternoon. I'm New Jersey State Senator Ronald L Rice, and I have to say L because I'm in Washington and my son is Ronald C. Rice. He does a lot of YouTube stuff, and he's down here, so I just want to be clear who I am. I'm also the third senior serving senator out of 40 in the state of New Jersey. I've been there 32 years. I'm a former law enforcement officer, detective investigator. I'm a former city council person for 16 years, 4 years, deputy mayor, Vietnam veteran. And my background is criminal justice administration. But I live in the city of Newark since 1955. I've not left, came home the night of the 1967 riots, and then got orders to Vietnam. I'm a college grad. I've been to many of them. And the thing that disturbs me the most is that I'm a product of the civil rights movement, and I'm a product of the racial South. And the reason I tell people, Congressman, I went to New Jersey in 1955, I always remind them of January 1955. I was 9 years old, so I could read and write. But if you go back 2 weeks, and it was 1954, that's when it was Board versus Brown versus Board of Education, Topeka. Okay, so as a result of that, I know what it is to live in segregated communities. I know what the struggle was to allow us to go to school and get education so that we can better our lives and mix and get away from all this craziness. In New Jersey, we are being sold, and what offends me the most is not so much for quote-unquote what white folk who are trying to make money and white folk who have other agendas are doing. Disturbs me the most is what black leaders are doing. After all this struggle for a quality education, for all this struggle to get experience, life experiences, it's that they're accepting what is being told to them. We're accepting the fact that all of a sudden that in New Jersey we're being told we need to legalize marijuana primarily because it's a social justice issue. There are more black people in jail for the use of marijuana, personal use of small amounts than white people. Is 3 times more. Well, we was told the same thing by the same groups about bail reform, and they messed it up. They took away our constitutional right to bail, which was a totally different issue. But when you look at this, the question I have is, okay, why do we allow people to use data that we know better than anyone to sell their products? And so my talk to my colleagues who are putting in these legalization bill, if you finally agree with us, because we've been saying it for years, you've been ignoring it, that it's discriminatory, disparity issues, more of us in jail than other folk who do the same thing, then turn us loose. They say they can't do that because it's complicated. But why is it complicated? It's complicated because we have to legalize. Well, I'm telling you this, it's insulting to me and people of goodwill and people who look like me who come from the movement I just spoke about in the history of struggle, and to be quite frank, the history of slave families. It's insulting because what you're telling me is that even though I shouldn't be in jail, you're not going to turn me loose unless I help you make some money. It's also insulting to me because we've been asking for years, long before opioid, I've asked for $100 million to deal with drug treatment centers and beds for people, and they give us free needles. And a free needle has nothing in it but air. You put it in your veins, you die. And all of a sudden, they want $300 million for opioid now, which I think we have to address that. But in the meanwhile, they want to give us legalization of marijuana. What I'm being told by my colleagues in New Jersey, there are so many people dying from the opiate problem that they believe when they went to Colorado that by legalizing marijuana, there would be a shift from opiate to marijuana, and therefore you won't have as many deaths. Well, that's problematic with someone like me who try to use my common sense, in my academic sense. As I told the Senate President, then you're transferring the problem. We need to deal with both. Because when you look at transferring the problem, you make it less deaths, so you think, but the social justice issue is one that you're promulgating and you're saying it's not money when in fact it is money. Because if it's not money, then if you want to talk social justice, I shouldn't be in jail, then we can decriminalize. That's what we can do. We can make it so you don't go to jail, you no longer have a criminal record. This way you can go and get a job. We can also make sure you get treatment, and we can expunge records. But you're not going to make any money off us. And so what I always tell them in New Jersey, and we've held 3 hearings we get on the third hearings, I've always said, okay, let's talk about what we know before we do this. We know all the things that were said here today based on Colorado, Washington, California, elsewhere. But let's talk about what we know about New Jersey, because you have to put things in perspective. What I know about New Jersey, in New Jersey, my office is 5 blocks from a village called South Orange, New Jersey, which is predominantly white, upper class, wealthy, middle class people, and Seton Hall University. And what I do know is that in Newark, where my office is, down the street from me on my block, people get shot on a regular basis, and they are doing drugs, and they are homeless, etc. And I got a bodega on almost every block, and sometimes 2. What I do know about New Jersey, where it's not legal, is that there are people who we're trying to help with subsidies. They're getting food stamps, and they're taking the food stamps to the bodegas right now, and they're cashing them in, not buying food. They're being ripped off. You have $100, they'll give you $40, and they're going to the corner to buy drugs, regardless of what the drug is. So what I do know is from all that we know without longitudinal studies, but at least 4 or 5 years in Colorado, is that when you legalize marijuana, there's a substantial increased use of people who never used any kind of drugs. And so common sense dictates to me in New Jersey, if I legalize marijuana, I'm going to get a substantial increased use of people who never use it. And within the aggregate of those people that increase use, there are going to be some food stamp people who are going to start to go to the same bodegas. Unintended consequences. My kid go to school, your kid go to school, and the teachers said, why are you trying to take the kids' food? Are you hungry? Yes. Did your parents feed you this morning? No. They said, are you going to come home? Or yes, a little bit. In my state, they're not going to call the parents. They're going to call what we call DIFAs. And DIFAs going to come out and take those kids out of that home. Unintended consequences. It's happening right now without legalization. Another quick 2. Low-income people, working people struggling, they're paying $1,200 and $1,300 a month to live in slum properties. And when they live there, they're stretching. All of a sudden, they're in this new population, never use drugs. Now all of a sudden, they like it. They try it. They start to shave off the rent. They go to the landlord. They said, Bishop, I'm a little short this month. Bishop said, well, you've been a good couple. You've been here a long time. We all run into those kinds of problems. See me next month. Next month, the same problem. Bishop said, we don't roll this way. I have a mortgage to pay, but see me next month. Next month come around, Bishop said, you're evicted. So now I've got people back in the system who are homeless. And the final thing I want to say is that Seton Hall, Newark is a college town, New Jersey is a college state. Seton Hall is 5 blocks away. So if Newark decides to legalize marijuana, and I'm going to have all this commercialization next to my bodegas with all the lipsticks and all the other kinds of things and products they're having, and South Orange doesn't want it, I'm telling you what's going to happen. I'm not guessing. I know. The students at Seton Hall University and that majority white population, middle class and others, in South Orange who want to try it is going to come to Newark in front of my office. And somebody's going to get killed. Killed. And it's going to be violent crimes. And the newspaper going to say it's racial when it's not. It's about the drugs and the money. Because if you're black and you come from across the line by it, they're going to kill you too or whip you up. That's going to happen. If Newark decides that we don't want it and South Orange wants it, what's going to happen is this population, predominantly black community, including the knuckleheads on the corner, but the folk who never bought drugs, they're going to go up and be inquisitive to see what cupcakes and gummies and lipstick is all about. And when they cross the South Orange line, they're going to be stopped by the police for right reasons, not wrong reasons, and we're going to say it's profiling. We just addressed that. And so I have a real serious problem with my colleagues' mentality of listening to people without doing their own research and putting together what we know with legalization, what we know is happening now, and being objective. In closing, let me say this. As chair of the New Jersey Legislative Black Caucus, we've had 2 hearings, we're having the final one. And I've asked my members, we're not going out telling the people we for or against the legalization of recreational marijuana, even though we have our own individual views about it. We want the people to know the facts. In New Jersey, thanks to Sam and thanks to Ramp and the congressman, et cetera, We have people providing information like you're doing today on the other side. But I'm going to leave this with you, for Sam and others. What I want to do when I go back, and we can have this discussion, because I tested this last night, I kept saying that people don't know the difference and that we need to do a grassroots campaign on knowledge. I need to talk to those senior citizens who have to walk down the street and afraid to go. I need to talk to those parents and single head of household PTA folk and everyday working people who just monitoring this. They're not following people around pro or con. They're just listening and hearing. Because when I tested this last night, I asked some people who were elderly and middle-aged people at a debate. I was on the side talking to them. They raised the question. I said, do you know what recreation marijuana is? And the lady said, I think so. That told me something right there. I said, well, if you think so, let me say this to you. If you legalize marijuana, okay, since you said it may be okay to do that, do you know that commercialization right out here on South Orange Avenue, you're going to have stores selling lipstick and cupcakes? Oh, we can't have that. How come someone is not telling us about that? You understand where I'm coming from? And so we need to be talking to people, not folk who are following folk around with information from one side and the other side. We need to get in the hood and talk to real people. So I just want to thank you very much for this opportunity to come down and share my concerns. But my concerns are coming from really an educated and informed person who live in a community that I've represented for over 30 plus years, and one who understands this stuff very well in the relationships. Thank you very much.
Good afternoon. I'm Christine Miller, a neuroscientist, and I'm going to talk about how marijuana has been given really a free pass by our politicians, with a few exceptions here, and by the media. Really, there's no other drug in America that can be sold without a listing of side effects. But marijuana is sold in dispensaries across this country with no serious warnings whatsoever. The side effect that I care about the most is a disorder that I dedicated my career to researching, a suite of disorders, really, psychotic disorders. And you heard Dr. Lev mention, she sees examples of that in her clinic on a pretty regular basis, I believe. My experience was that marijuana-induced psychosis, although that was not something I researched, is actually now the most well-replicated finding we have in schizophrenia research. More well-replicated than any genetic finding, and I looked at a lot of genes when I was in the lab, more well-replicated than any other environmental factor. Now, it is true that those who have a family history of psychosis are going to be more at risk, but that's about 10% of the population who has either a first or a second-degree family member with some type of psychotic experience. And it doesn't mean that the other 90% are safe either. I'm going to get to that later. The effect size is large. 15% THC increases the risk fivefold, which translates into about 1 out of every 20 regular users of high-strength product being at risk for developing a chronic psychotic disorder if they don't quit in time. So I'll touch briefly on the literature that illustrates the causality. There's no single paper that is definitive. Rather, it's a constellation of studies that have looked at the question from different angles and illuminated the causal basis. There are hundreds of studies I'm talking about. So here I'll list a few. Numerous epidemiological studies have shown a dose-response effect between the amount of marijuana use, the concentration, and the psychotic outcome. In pharmacological research, this is considered one type of evidence for causation. In prospective studies, they have answered the obvious question, which comes first? Is it the marijuana use or maybe the psychosis comes first? So they followed teens, thousands of teens, until they reached their young adult years. And they found that the preponderance of evidence is that the marijuana use comes first. If you administer purified THC in the clinic under controlled conditions, to subjects who have no family history of psychosis, so I told you I was going to get to that, 40% will develop psychotic symptoms right there on the spot. Now, fortunately, they're reversible at that point, but for recreational users who experience such symptoms and continue to use, about 35% will progress to what is known as a full psychotic break, where they have more than multiple psychotic symptoms at once, and they don't recover so quickly. They'll have paranoia, racing thoughts, hallucinations, delusions of grandeur. And of that group, about half will end up with a chronic, long-term, often lifelong psychotic disorder. These are very large studies that have been conducted in Europe, where they have centralized healthcare systems which enable a good collection of data for controlling for demographic factors. The two studies I'm talking about totaled over 20,000 patients, and they looked at other drugs as well. Marijuana was by far the most effective at reaching that sad end state. It was worse than LSD, than PCP, than cocaine, than methamphetamine. So I like to say, lace your LSD with a little marijuana, and you're more likely to become psychotic. There are many studies to talk about. I don't have time now. There are more. But I'll move on to the fact that this type of mental illness, like all mental illnesses, carries a heavy stigma. So the families that have experienced it aren't that willing to speak out, for obvious reasons. They want to protect their loved one. But there is a website you can go to where a few families have written their stories, momstrong.org, and I highly recommend it. I'd also like to point out that, let's see, my final 2 points. Marijuana is often compared to the legal drugs alcohol and tobacco. And I have this to say about the alcohol comparison. Unlike alcohol, if you are using 2 servings of marijuana per week, if you're not driving, even if you're not driving, that is not a safe level of use. That is exactly the level of use that raises the level of the risk of psychosis significantly. And compared to tobacco, where you actually have sort of a window of time, a grace period, if you will, to correct your youthful mistake of picking up this habit, actually, I think until age 40, if you want to, get over your risk of lung cancer, if you quit by then, you might be okay. With marijuana, the severe psychiatric effects come on very early, very fast, and can be extremely devastating at a young age and last a lifetime. So you don't have that grace period. You can't be forgiven this youthful mistake, and you don't know, who it is going to affect. So to conclude from the press here, I hope there will be more reporting on this dark side of marijuana. There are world experts who can be reached out to, Dr. Robin Murray at King's College in London, Dr. Jim Van Oss at the University of Maastricht in the Netherlands. And from our government, I think a Surgeon General's warning would be a great first step, much like the warning that was given for tobacco so many decades ago. Thank you.
First, let me thank everybody who's spoken already today and really appreciate the eloquence and expertise that all of you have brought to this and the service to our country that many of you have exhibited throughout your lives. My name is Patrick Kennedy. I've had the honor to be the author of the Mental Health Parity and Addiction Equity Act, which says that basically mental health ought to be treated the same as overall health. I've spent my life campaigning to see that this parity law, as it's known, is fully implemented so that we can address mental health and addiction challenges in this country, just like we address diabetes and cardiovascular disease and cancer and every other illness. And I found that it would be inconsistent for me, on the one hand, to be around the country trying to advocate for adequate coverage and reimbursement by insurance companies for mental health and addiction services, while ignoring that there will be a new addictive industry that will put more people in jeopardy of both mental illness, as you've just heard, and in jeopardy of more addiction. It would seem to me, while we're in the midst of a 5-alarm fire in this country with addiction and mental illness, suicide rate never been higher, twice the car crash rate, overdose rate surpassing well past what we saw in the height of the HIV/AIDS crisis, our country would wake up and say, we must have a problem here. And if we do, it would seem to me the last thing we would do is pour gasoline on the fire. If everybody's now looking at pharma and saying they got us into this mess because they had unscrupulous practices of selling more OxyContin than were needed because they were making bigger profits, and the more people they got hooked, the higher those profits would be, why would we at this stage in our lives as a nation say, well, let's repeat that mistake? And instead of oxys, we'll have all these new forms of this new addictive drug, THC, because it's not marijuana, it's elixirs. I don't know if anyone's heard what an elixir is. It's like that Fanta orangeade with THC in it. So when you're at the bar, you get your Absolute and Red Bull. Now you're seeing where I'm really coming from. And now you order your elixir because you've got now another chemical to bring to the table. And, of course, they're edibles. Well, what the hell are edibles, people tell me? Well, those are the things that you might not be aware of how much THC is in what you're eating. Hence all the emergency room visits, because people thought, well, I only took a bite or two. It never made any impact on me. So I finished the brownie. And next thing I knew, I was hallucinating in an ER. But let's not look at just this in an anecdotal in terms of these individual cases. Let's just look big picture. Our country clearly loves to self-medicate. Okay? And more than ever before now, because of the stresses and anxieties brought about by a shifting economy that does not share wealth equally across this country and leaves more and more people feeling insecure about their financial well-being and about the future of their families. That's the truth. And so we have more and more kids disconnected because they think they're connected because they're on their phones and iPads, but in fact, that's leading to more isolation and lack of human connection. And so we're thinking, what should be our response? Our response, according to all the experts, should be we ought to be giving those kids social emotional learning skills. We ought to be equipping them with coping mechanisms and problem-solving skills. I had the honor of rededicating the Fort Bragg John F. Kennedy Special Warfare Center. And the general said to me, you know, Congressman, with the Green Berets, we have the most mental health, training and delivery for our Green Berets than any other branch of the service. I said, these Green Berets, they don't need mental health. We all know the Green Berets are the best of the best. They said, no, we don't look at it that way. We look at it as a force multiplier. I said, what's that mean? He said, because of the stressful situations we put our special operators in, what makes them so special is their ability to navigate the stress of their environment. So they look at stress management as a protective shield. All of these kids, all of America is heading into a global economy that's causing them a lot of stress. Are we going to give them the shield, give them the mental health skills to navigate and cope with all the stress coming down? Or are we going to look the other way and allow an addictive industry to say, oh, we've got an easy way out? And furthermore, that easy way out is going to get you caught and imprisoned through the kinds of illnesses that you've heard described here today. And it would seem to me I know with my 4 kids, soon to be 5, I want to help make them, as you were saying, Bishop, as strong as they can be growing up. I think everybody wants their kids to be as strong, and I don't want anybody to grab them and take them down. The enemy coming across the border and taking my kids hostage by addiction and mental illness. So those that are out there selling this stuff and promoting this stuff, you're going to have this team right here and many others saying, not on my watch. And I want to thank Senator Rice in my new adopted state of New Jersey for leading the charge and doing it as eloquently as he's done. And we're looking forward to turning back this effort to legalize marijuana in New Jersey so that we don't make it the Garden State, but instead we say it's a state that's going to be safe for our young people.
Thank you, Congressman, and thank you to everybody on the panel. We have time for some questions from the credentialed press. Yes, sir. On the left.
Mr. Kennedy, Senator Gardner of Colorado just struck a deal with President Trump not to enforce the federal marijuana laws in Colorado. How do you feel about that?
You have a wireless, or you can use the audio?
Well, the President has been very forthcoming about the impact of addiction in his family's life. So much so that he makes no bones about the fact that he does not drink alcohol, doesn't even have one single drink because of the impact. That should tell us a lot. And he understands this personally. So, the biggest issue here is denial in our lives. Those of us who come from homes with alcoholism and addiction, who live with it in our own lives. In fact, the people with addiction often are the last ones to know. It's the single characteristic of a mental illness or addiction, is the person suffering from it is the last person to recognize it. And I would say as a society right now, collectively, as a nation, we are in a collective denial about the scope and severity of addiction in this country. And people call it opioid, or they call, at the end of the day, as all these experts can tell you, it's addiction, it's addiction, it's addiction. We can substitute one for the other. But the bottom line is we have to understand this for what it is. And I think, obviously, it detracts at a time when we're in an all-out crisis in this country of addiction. It makes it more difficult for us to have a clear and consistent voice and policy about this, to be, giving a wink over here while saying maybe it's not a smart idea over there. That is disassembling. Isn't that, Doug? That's what we call it in recovery when we're trying to have it both ways. I certainly hope the president, depending on how true this story is, makes sure that his policy is consistent, because frankly he has a commission and has been supported through the rest of his administration to really ensure that this is not legalized. So I'm hoping that this is not literally the case that's being made out to be.
Say one more thing about that, too. It's not only the President's Commission, also his Assistant Secretary of Health, who's talked about the harms of marijuana as some of his other appointees, as well as a lot of the President's own base. Law enforcement groups will be soon releasing a letter opposing the President's move and so-called deal with Senator Gardner, because we have seen in legalized states the underground market get even stronger. One of the promises is that the criminal market goes away under so-called regulation or legalization. In fact, we know that it adapts. It's able to infiltrate actually that legal market quite easily. And this has been a huge problem for law enforcement to be dealing with in these states. So we have the major law enforcement associations opposing that recent move, and we'll be sending out a copy of that letter to the folks here. Yes. Sure.
On that same point, we in New Jersey have met with the Association of Police Chiefs, and they have come out in New Jersey against legalizing marijuana.
Senator Schumer today proposed decriminalizing marijuana, not legalizing it. Do you support that move?
Actually, we don't have the full text of the bill yet, so we can't really comment on that. But from what I've seen, it's more of what we would call descheduling, not decriminalizing. So it's called decriminalizing, but from some of the text that I've seen, and we're still waiting for the full text, it actually would allow states to full on legalize. So I think we'll have to wait to get more details before making a final judgment. But it is important to make that distinction between decriminalizing and legalizing. But if you descheduled it, that would allow states to fully legalize and commercialize.
Also, regarding Senator Schumer's statement and pending legislation, how much difference do you think this is going to make in the long run in terms of possibly, legalizing marijuana across the country?
Well, I think the issue is that there is a big industry that is trying to fund, advocacy in this area. There are dozens of lobbyists from the marijuana industry now that unfortunately are funding candidates on all sides. First of all, we have to do a better job in the public health community of keeping those candidates and politicians accountable. The public has a right to know if you are a lobbyist like John Boehner was for big tobacco, and now he's working for big marijuana. And we have to start doing that. In terms of that piece of legislation, again, I don't think actually marijuana is much of a motivating factor for voters. When you ask opinions on marijuana, people have all kinds of opinions depending on how you frame the question. We found that when you offer decriminalizing, more people choose that actually. But as a motivating factor to vote, as a reason to to lead on it politically, none of the polls and what we're seeing is that this is really a motivating factor. So I think a lot of this is unfortunately members of Congress hearing from very loud voices of special interest groups, not very loud voices of the grassroots. And I got to tell you, with the amount of the thousands of kids in New York State that have died from the opioid epidemic, with over 90% of them, if the statistics are correct, marijuana having something to do with that history, I don't think this is necessarily a smart move politically for people of either party. And that's a message for Senator Schumer as much as it is for President Trump.
Can I say something right quick on decrim?
Yeah, right here.
And this is very quick. First of all, room on the streets is going to be over $100 million spent in New Jersey to get a bill through. I don't believe the votes are there now for any bill, but on the decrim side, what's been happening is that those who are promulgating legalization, they continue to tell people that we like decriminalization, but decriminalization harm minority people. And it harm minority people because even though you're going to come out of jail, you're going to still get a fine. And if you don't pay the fine, you go into jail. They give the impression through the conversation that if you legalize drugs, you don't get arrested. Some kind of way the press and the public have to make it clear you're going to get arrested whether you decrim or legalize. And I think that's important because that's the way it's being sold. And I think once the public recognize that wealthy people and special interests is spending a lot of money, because they're not going to go back in the history of George Soros and the Drug Policy Alliance. They're not going to do that. But once they recognize people trying to make money off their backs, and they recognize that there's another way of doing this social justice thing that keep coming up in our face in our communities, I think they'll see it differently. And I would hope that, Senator Schumer would take a look at true decriminalization and not playing games with it because his state borders my state.
And there's no sense in large fines without, and having decriminalization without actually having some kind of health intervention as well. I mean, it doesn't help us to have the same kid arrested 10 times and fined 10 times over again without an actual health intervention. And so there's a lot of lip service of saying addiction is a disease, addiction is a disease, addiction is a disease. But if it is, we have to treat it as such. And that means you intervene early. That means you offer evidence-based health care and health interventions. And so, we support bills that remove criminal penalties that have a health aspect to them so that we can actually move towards discouraging and reducing use as opposed to just perpetuating it and giving someone who already can't afford it probably a huge fine versus some time in prison. That's also not the right way to deal with it. Yes, please.
Thank you. Yes, good afternoon to all of you. Mr. Sabet, all of you, thank you so much for the impassioned wisdom, that you provided here today. I'm Kathy Henderson. I'm an elected representative in the District of Columbia. And my community, we are still fighting hard against that awful, awful Proposition 70 that passed here in the District of Columbia. We've mobilized the police, who are now working harder to shut down the pop-ups that sell the brownies. They come on they were coming on Sundays at 2 o'clock, lines in the community, taking up all our parking spaces. You pay your $10 to come in, you get your little white bag, and you come out with all kinds of illegal edibles that we don't want. So we're fighting back. My question is there an effort? Now we have a member of the council who has sent a press release to the U.S. Attorney's Office and the police asking to decriminalize prostitution and the whole. And I understand that this particular individual is a proponent of marijuana, sits on his porch, smoking as though it's okay. My question is, what more can we do, or is there an effort to really go back and revisit the issue, the slippery slope that happened in the District of Columbia?
Well, I think there is an effort, and I think we need to hear from really grassroots activists. We need to hear more from people like yourselves and others here so that your collective voices are heard. Right now, they're drowned out by a deep-pocketed special interest group that really has unlimited funds because it's in their business interest to pass legalization. They benefit when they pass their legislation, whereas us, who are trying to prevent bad legislation or promote good legislation, we don't have that kind of financial incentive. So it's very powerful on the other side. The only thing to counter it is I think we hear individual voices. I'll also ask people, you can download for free our advocacy app, which is a SAM Action app in an Apple or the Google Play Store, and you can actually get alerts to be able to write elected officials, to be able to show that collective advocacy that needs to happen. Because again, we see this as a bipartisan issue. We don't see this as one party or the other, and we see this as a public health and scientific issue. And whether it's going to take 5 years, 10, 50, or 100, we know, as Patrick says, we're on the right side of history. We know that as a country, we're going to collectively come to our senses at some point. We just hope we don't have to pay the consequences before realizing it. Please.
One added comment, Judge Burnett, I testify frequently before the City Council, and we need to see ANC people and others talking about the negative consequences. There's a move in the country today as a result of bail issues and talking about imposing bail where people can make the bail and sit in jail too. Would be another way of having these people sit in jail because a fine of $300 is imposed for marijuana users, and a person's been unemployed for 2 years. Where's the $300 coming from? So the whole idea of just decriminalizing and imposing a fine puts us in the same box we're in with people sitting in jail, even pre-trial, on bail they can't make.
Please.
I've reached out to my national affiliation and have asked them for all the full gospel churches in the USA to a meeting with my senior bishop to say I need a statement. I'm reaching across all ecumenical lines. People of faith have to operate on faith, and you have to call them out for who they are and what they are. They talk about social justice. I, too, remember the riots. Martin Luther King was in Newark the week before he went to Memphis. And so at 17 years old, I got to hear Martin. Martin said something. He said, you must do the analysis, but you can't have paralysis. You need to call on your faith leaders. You need to call on every organization that you know that moves in the community. 20 years ago, there was a group of clergy. We came together and we made national history because we negotiated the first treaty between the Bloods and the Crips in the city of Newark. And I was part of that group. You can get gangbangers that really will help you out, or ex-gangbangers, because that's who the community believes. And lastly, let me say this to you. Martin said that we must know there's always a time and to do right, and the time is right now.
Well, with that, we'll end it. We thank everybody for being here today. And to get more information, you can get at learnaboutsam.org, also the other organizations mentioned today. Thank you.
We have lunch. Good to see you always. Yeah,
Thank you so much. We have lunch. If you want to follow us. Appreciate
Nice to meet you. Yes. I love your glasses, by the way. They're great.
Nice to see you. Good to see you. Thank you. You guys are great. You guys are Thanks. Follow us when we eat lunch. Let's go have lunch.
I'm waiting for some.
Let's walk inside.
I've been looking for interns. Yeah, I've been looking for that. And we've done researcher from UVA. There's all the governors, Virginia governors. Yeah, I'll give you, it's all right. I mean, I have it. I just forget her name. So, because I've been emailing her, well, I wanted her to come help us for a rally. It didn't work out. But I just no, she's a researcher at the UVA hospital. So she's in psychology. But I just heard secretary this researcher will fall in. So maybe educators. I was looking at someone researcher and intern to be on Sakova, like honorary members. Because we had before, we had the executive board and our board members at large, but I would love to have advice from us. And so, because I because I was in Pennsylvania, I was like, oh, I was surprised in education. Just keep us up to date with research. So I can do it. We talked about this meeting about getting some of these folks to phone in and just give us updates. So this gal will be there on an ongoing basis. Kind of threw you off. Yeah, it's all good. It was all good. And that was.
And wrapping up this event here, you heard a reference at close to the end of the program to a congressional effort to decriminalize cannabis. About this, the Hill writes, Senate Minority Leader Chuck Schumer plans to introduce a bill that would decriminalize marijuana at the federal level. Senator Schumer told Vice News that the legislation will be released within the next week. The bill would reportedly remove marijuana from Drug Enforcement Administration's list of controlled substances